Okay, so a lot of people wondering what goes on during the chiropractic visit, so I just wanted to do a real quick video to explain that. I got my Vanna White. We're going to make an adjustment on her. And so adjusting the spine is all about improving motion. Motion is critical because when you lack motion, you lack nerve function. And so she's laying down here, and all I'm trying to do is contact the vertebrae, these guys, and they have all these ranges of motion that you could do. 360, not 300, but a lot of degrees of motion in her neck, in her mid-back, and her lower back. And they all have different kind of lines of drive. So when I make a correction, I'm using my hands, I'm using my instrument, I'm using the table. And so, for example, I can just tell by looking at her, and I've worked on her a bunch, she gets subluxated right up in here. We're going to make a small, and so that's a nice, easy. Now, she's got some restriction, added restriction here. So this guy is called an arthrostim. We use some of that. And I'm going with the line of drive, we call it, with the spine. Basically, where it's going to move the best. And so right up in here, you're going to see this little jackhammer. Okay? It's kind of like a jackhammer because, again, we're just trying to get motion in the spine. What that does, because the most common question, right, I get is, what the heck does that do? And so what it does, it vibrates that spine, okay, right at that joint where I can feel it fixated. And when you do it, it's allowing the joint to release itself on its own rather than me forcing it. And so it's just a super effective, super precise way. And when that happens, not to get all sciencey on you, but it releases these things called mechanoreceptors, which are your body's own natural pain receptors. And it's getting that joint working so that your body can experience spatial awareness, proprioceptive, which is nerve function, so your body can know balance and coordination and get your nerves working better, okay? So I want to finish her up. I'm going to go right up in here. This is an awesome move. We're going right up in here because all that forward head flexion stuff, her T1 gets messed up, and right there. And a little bit lower. Beautiful. Short, sweet, simple, no rotation, super safe, super effective, and it feels awesome. So that's what goes on with the adjustment, more than you ever wanted to know.